So thanks again to Deanna and Court and Latrice for providing a landscape of what's happening in Chicago and Cook County. And now we're sort of bookended by the national experts in terms of starting the presentations with Helen Binns, and then now moving to Susan Buchanan and Dave Jacobs to help us understand more from both a perspective on needed housing and public health interventions and what more needs to be done. And we've asked them both to basically do a call to action. It's my pleasure. I think we're starting with Susan. Am I right? There you are. Susan is director of the Great Lakes Center for Children's Environmental Health and Region 5 Pediatric Environmental Health Specialty Unit at the University of Illinois at Chicago. She has actually been a consultant in Flint and is sort of, again, one of those people that is called on a lot in terms of her expertise, and we appreciate your being here.
Thank you. I don't see my presentation on the bottom.
I had it up earlier.
Yep. Okay, thank you. All right, thank you. I don't have many slides, but I do have some thoughts that I want to challenge you with today. I love putting up the periodic table for all the science nerds. Lead, this symbol is PB, which is in yellow at the bottom right. So I want to go over some lessons from Flint. I do have a disclosure. I received funding from the EPA and ATSDR to be the director of the Great Lakes Center for Children's Environmental Health, which is a PACU. It's a terrible name. Blame the EPA for the Pediatric Environmental Health Specialty Unit name. But what we are is a center of expertise in children's environmental health for the entire Region 5. All right, let's spend some time on this slide. You've already seen this a couple times today in Helen's talk and again in another talk, but it shows you the public health success we have accomplished by lowering the blood lead levels over the past couple decades. So Helen Binns already showed this at the far left, that the mean was over 14 when a lot of us were growing up. It was even higher before that. So we all experienced lead levels probably over 10. Most of us in the room had lead levels over 10 as we were growing up. And then you see the dramatic fall to present day, where the mean now to 2009 to 2012 in the NHANES is 0.806, right here. So what I added then was from NHANES, which is a large survey of the entire planned to be representative of the entire country, in NHANES 2007 to 2010, oops, sorry about that, trying to get my thing to work, 2.6% were greater than or equal to 5. And we've already seen today that the levels in Chicago were much higher. The percentage in Chicago of children greater than or equal to 5 was around 9%, did you say? Not 9%? Pardon me? What is it? 5%. Okay, so it's still double what the NHANES was in that time period. I added here this 5 is the current action level. And then here are levels from Flint. This is what Mona Hanna-Tisha published in the American Journal of Public Health when she looked at her cohort of lead levels from her local hospital in Flint. And she found that before the water source in Flint changed to the local water source, there were 2.4% of the kids had elevated lead levels. So here's NHANES. We already said Chicago was about 5. And afterwards, it went up to 4.9. Now, there is some other state of Michigan data that shows that this level is even higher. So the percentage of children with elevated blood levels did change significantly comparing before the water change to after the water change. Nevertheless, I want you to look at this decrease, this average of here over 14. This is probably close to, I haven't seen the mean in Flint currently. From word of mouth, I've heard that it might be around 6. I think it's probably lower. So what do we think about this graph? And these are some of the questions I'm going to pose. What I wish for the people of Flint is that they could see a room full of public health professionals, MDs, and PhDs that grew up in a time when the average lead level was over 14. Okay? So, I'm going to just show a few slides. Oh, I only have 10 minutes. Oh, I could blather about this forever. All right, I'll hurry up. What I want to show is a few slides about the effectiveness of early childhood interventions. Dr. Binns mentioned this already. A couple slides are hers. And this effectiveness of early childhood education programs and reducing risks, you have a copy of the executive summary in your folder, okay, showing that nurturing and supportive home can directly benefit the children who have lead poisoning and can actually help them gain some of the IQ points back. High quality preschool and Head Start. It specifically shows improvements in language literacy and math, reduced criminal justice costs, improved productivity. Head Start programs have been shown to increase reading, writing, vocabulary skills, and general cognitive development. So there are data showing that interventions help children with their neurodevelopment. We know lead disturbs the neurodevelopment, so it emphasizes the importance of these types of activities for these kids who are lead poisoned. Specifics on language enrichment. This is Helen's slide. If you begin in the early months of life using repetition, enunciating speech, having conversations with young children, listening to young children, being positive, reading to them, has shown to mitigate the effects on neurodevelopment. Nutrition, Dr. Binns also already mentioned treating iron deficiency, ensuring adequate intake of calcium, providing vitamins are all really important to decrease the absorption and the health effects from lead. So we've got early intervention education programs, we've got parenting in terms of promoting conversations and speaking with children, and we've got nutritional interventions. All three are needed to help overcome the effects of lead. So now I want to spend a couple minutes on the lessons of Flint. I have some ideas about these, what these should be. I don't have the answers. So what should be the public health messages? One option that has been the option of choice by the media is that these children have been poisoned. So Michael Moore wrote on his website, this is a quote from Michael Moore's website, "They are ruined for life, and someone needs to tell you the truth about that. They will forever suffer from various neurological impediments. Their IQs will be lowered by at least 20 points." Okay? This isn't true. Not one phrase in that statement is true. I love what Michael Moore has done. This is a disservice to the parents in Flint. It has led to emotional trauma, a lot of anger. The anger, I think, in many cases is justified because of how disgusting that water was and that residents were absolutely ignored. But I also worry about a level of hysteria. Oh, I only have 5 minutes. Well, it's halfway through. Okay, no, my 10 minutes. I worry about hysteria in my discussions with people from ATSDR who are over there working, reporting that there are people worried about teeth falling out now and paresthesias, so numbness and tingling in the extremities from some of these lead levels that we know do not cause these types of health effects. Okay, these lead levels are not high enough to cause this. So I worry about the trauma in the parents. So that's one public health message. Another possible public health message is this message that early interventions can help. Where might that lead? Maybe to some decreased emotional trauma, maybe to more funding for preschool, Head Start, and parenting education. Those three things I mentioned: nutrition, parenting, and early educational interventions, and good nutrition. As I mentioned, this nutrition might lead to more increased availability of healthful foods. We know that Flint, Michigan has areas that are food deserts. Fresh food is not available at all. All right, so those are three potential public health messages. I want to go through 6 potential policy messages. And like I said, I don't have the answers. These are questions I'm raising about what should our public health messaging be? What should our policy messages be? The first one, the government ignored the people. That is absolutely the case. There is much justified anger in Flint over the state of this water. It was, as I said, disgusting. It had E. coli. It was discolored. It had, then it was treated with too much chlorine, so then it had chlorine byproducts, and then, of course, this elevated lead. Another public health message, public policy message, is that this is only the tip of the iceberg regarding lead in water. So you've seen the lectures and the data today showing that lead in the water and lead poisoning in inner cities is a big problem. The media has uncovered episodes or incidents in other cities that also have elevated lead in the water, so we need to start talking about it more. Another possible public policy message is, should we test every tap for lead? Every tap in the city, every home, should it be tested for lead? I don't have the answer to that. Court gave some guidelines for testing water and what the current regulations are, so you now know what the current regulations are. Should they be changed? Should all the lead service lines be replaced? This is being discussed in Flint. My first response as practicality is, how could this possibly take place? Where could we possibly find the money in the infrastructure to replace every pipe leading from a street to a home? Should we target high-risk kids and replace those, all those pipes? The environmental activist in me says, hell yes, let's replace them all. These children are being poisoned. It's time to get rid of it. Should funds go towards early intervention? Should those funds that would go toward replacing lead lines go to early intervention services? And should we screen infants and pregnant women for lead? They're not currently being screened. There's no recommendation to screen children under 6 months, 6 to 9 months for lead. But what about the formula-fed infants who are drinking formula that is reconstituted with lead-contaminated water? There are guidelines for lead in pregnant women. We know lead crosses the placenta, causes health effects in infants. I do a lot of speaking to OBGYN residents and prenatal providers, none of whom are screening pregnant women for lead, despite there being lead guidelines from the CDC. Guidelines from the CDC published in 2010 recommending screening pregnant women with questions and then an answer yes to any of the questions similar to the questions Deanna mentioned, to then have that trigger a blood lead test. Okay. That is what I have to say. Like I said, no answers, a lot of thoughts for discussion. I think Dave is also going to generate some discussion, so this is like the radical session, right? So let's hear from Dave Jacobs, and then we can have some discussion.
Susan, thank you.